right, thanks everyone for joining the webinar today offered by the Community Partner Outreach Program. My name is Sean Snyder. I'm a Regional Outreach Coordinator that covers the Multnomah and Clackamas County region. I'll also assist in other projects statewide, and most of our team helps to balance doing some of these webinars and module series every Tuesday, first Tuesday of every month. Today we're going to be covering transitions to Medicare. During the development of this webinar, things kind of shifted a little bit, so we decided to do a little bit more of an overview of Medicare, kind of a Medicare 101, going over the different pieces and parts of Medicare and how they fit together, as well as some of the Medicare savings programs. And I'm really hoping personally that this is kind of an introduction for folks. If there's anything that we can't answer today, we'll make sure to follow up and a follow-up email with any other Q&A or questions that have come up for today. We do have a few folks that are on the webinar with us today that can help answer some questions, especially those pertaining to our Medicare savings programs and other non-Magi programs. But not all of us here today are necessarily subject matter experts in regards to Medicare. So we definitely have some folks that we can get those answered by. Again, my name is Sean Snyder, and I'll go ahead and introduce my colleague. Tina, would you like to go ahead and introduce yourself?
Hi, everyone. Thanks, Sean. My name is Dina Amar. I'm the Regional Outreach Coordinator for the Gorge. And today I'll be keeping an eye on the questions box and helping Sean with any tech issues. Thanks so much for having me.
Awesome, thanks, Dina. Definitely with GoToWebinar, a necessary ally to have. So I'm very grateful for her being here today and helping to support. And then we have two panelists with us today. Janelle, do you want to go ahead and introduce yourself?
Sure. Hi, I am Janelle White. I am a policy analyst with APD Medicaid policy.
Awesome. Thank you, Janelle. And then Heather.
Hi there. My name is Heather Burkus. I'm also a policy analyst with Aging and People with Disabilities, non-Magi Medicaid on the financial side. So same unit as Janelle.
Awesome. Thank you, guys. And again, I really appreciate you being here. Some of these programs are quite complex, and although we're going to be going over just an overview, I know it can bring up a lot of questions really quickly. So thank you for making the time to be here today and help support in, shedding some light on Medicare, which I know is a new topic to a lot of our community partners, and can be a bit of a black hole when it comes to sort of information around access to care. The last thing that I will mention, again, for anybody that just joined, because we're up to about 73 attendees now, is that there is a handout on the module Medicare transition slides. So if you see on your right-hand side, you'll see a drop-down for handouts. You should be able to download that, and you can follow along with us as well. It does have access to the notes within that download. So hopefully it'll provide a little bit of context for folks. Okay, all right, I'm going to go ahead and move forward. So the objectives for today is going to go over a Medicare 101, to really go over the different pieces that go into Medicare, how folks can choose different pathways. We're going to talk about our non-Magi programs, Oregon Supplemental Income Program Medical, as well as Medicare savings programs. That's definitely where Janelle and Heather are going to help provide a little bit of background and support as well. We're going to have a few Q&As. The Q&As are just kind of some pre-set up questions that we added into the training that hopefully will help answer some kind of common questions I've gotten from community partners in the past. And then we have a list of resources and guides for you all. Again, any of the things that we talk about today can be a training in and of themselves. I know I've attended the SHIBA, or Senior Health Insurance Benefits Assistance Program training for their volunteers, and it is 2 straight full days of training and then hours of training past that. So Medicare is a complex topic. So we're not going to get everything answered today, but hopefully we'll provide a little bit of clarity. And then we'll of course have options for Q&A at the end if there's any questions that folks have that either we weren't able to answer as we were going through or that come up. So I'm excited to see what you guys are interested in. Okay, so for the Medicare overview piece, we're going to briefly talk about who's eligible, how and when do you enroll. We're going to talk about original Medicare and what that means, Part A and Part B, original Medicare expenses, and then Medicare pathways. So different ways that people can essentially purchase or gain or get other pieces of insurance added on to their original Medicare to help cover any out-of-pocket costs. Really the point and purpose, I feel, of this training especially is for you guys to know that there are expenses with Medicare, and what can community members do in order to help make that more affordable? What programs can we be helping getting them connected to their savings programs? And how can you help support them in getting there? All right, so who is eligible for Medicare? So they're going to be varying communities and groups that become eligible. Some of it has to do with age, some of it has to do with disability status, and other criteria as well. So Medicare is health insurance for people who are either age 65 and older, those that are younger than the age of 65 but have received are either currently receiving Social Security disability income for more than 24 months, have some form of disability as indicated by the Social Security Department, end-stage renal disease, or Lou Gehrig's disease as well. There are, as you can see, different types of criteria. There are other eligibility in the sense of costs that are associated with Medicare, depending on your work history as well, and we'll go over that in a little bit. But this is just kind of the basic who is eligible for Medicare. And then there is also immigration requirements as well, to be U.S. citizen or lawfully present in the U.S. For 5 years or longer. There are some protected communities that do not necessarily have to abide by the 5-year, but again, this is an overview for today, and we can get very nitty-gritty. So if any of the folks have questions about the immigration piece as well, we can always follow up in more detail for folks in the future as well. So this is who is eligible for Medicare. And then when we're talking about Medicare as a program, there is something called original Medicare, which is the first two parts of Medicare that were originally developed and created, and that covers Part A, Part B are the common portions for Medicare. When you guys are getting signed up, or when community is getting signed up for Medicare, these are the first two portions that you're going to get signed up with the Social Security Office and the Social Security Administration, and it's really considered or called original Medicare. So Part A is going to be, and it's going to help with your hospitalization or inpatient care, skilled nursing care, home health care, hospice care, and literally pints of blood itself. So if you're in the hospital and you need a transfusion, things like that, Part A will help to cover for that. Your Part B of your original Medicare covers your outpatient care. So your regular doctor's visits, emergency room care, urgent care, diagnostics tests, ambulance transports, of that kind as well. So as you can tell, when you get signed up for Medicare and you get signed up for your original Part A and Part B, there are a few pieces that are missing. So you don't have necessarily outpatient prescription costs covered, or other items as well. And so we'll look at what are other pieces that you can add on to original Medicare as well. There's also some services that you guys may be familiar with that are not covered by Part A and Part B. That's going to be long-term care, dental care and dentures, outpatient prescriptions, hearing aids, routine vision and eyeglasses, routine physical exams, travel alternative care, and items such as that. And as we talk about the other pieces that get added on to original Medicare, we'll see that some of these services are picked up in smaller fashions or limited services. So there are some dental care and some vision care that folks can be eligible for. They are limited, but we'll talk about what pieces can be added on to original Medicare that can help cover those parts.
Hey, Sean.
Okay, so, oh yeah, go for it.
We have a couple questions.
Sure.
The first one is, are the COFA citizens eligible for Medicare?
Yeah, COVA citizens should be eligible for Medicare. The thing that becomes a little bit complex, and this is similar for a lot of our immigrant communities, and again, Janelle and Heather, if there's anything that I miss or could be more clearly stated, let me know. So my understanding is that community members are eligible. What really comes down to it is for folks' ability to afford Medicare. So say for Medicare Part A, we will talk about a little bit later on, can have premiums. It depends on someone's work history of their spouse. So I think what ends up happening a lot of times for Medicare is it can be extremely expensive for community members. So for COFA specifically, and that for folks that are on the call and are not familiar, is that citizens that come from the islands of the Compact of Free Association, Marshall Islands, and other regions. And they most recently regained eligibility for Medicaid and Medicaid programs. And Medicare savings programs and OSIPM and our other programs are paid for with Medicaid. And so for COFA community members, they may have been eligible for Medicare in the past, but it may have been very expensive. With the addition of our Medicare savings programs, and now that they are eligible for some of those financial assistance pieces, that will help them to actually be able to afford Medicare, which prior may have been more difficult. Okay, I hope that provides better context.
Are you ready for more?
Oh, go for it.
Does Part B include air ambulance or life flight?
That is a great question. You know, guys, I know that I had indicated that it covers ambulance. I will need to get back to you on that one. I wish one of my colleagues, Donna Delicott, that is like our Medicare guru, was not able to make it today. So I will make sure that we follow up with you guys on that question. I don't want to overstep and answer anything that I'm unsure of. Again, trying to be as high level as possible, and I know that's not going to answer everyone's needs. But let's get back to you on that question.
Thanks, Sean. There's one more.
Yeah. Sure.
The 5-year bar is going away in 2022. Is that not the case for Medicare?
Another wonderful question that I also don't know the answer to, but I will want to know the answer to that. And if the 5-year bar is going away, yes, let's do some investigation on that. I'll check in with Donna and other folks as well. Heather, Janelle, have you guys heard about that at all for immigration requirements for Medicare?
This is Janelle. I haven't.
You haven't? That's great. No worries. Yeah, that's another great stumper. So we'll get back to you with it, hopefully an answer on that one as well.
I have heard rumors. I'm not completely updated, but yes, I've heard whispers of that.
We've heard whispers. Hey, we're moving in the right direction, so that's good.
Yeah.
I mean, I would be extremely grateful if that were to go away. So I apologize for not being up to date on that new information. So hopefully we'll have some more information for you guys. I know, and I will be honest, sometimes when it comes to these programs, until the policies have been fully developed, there's sometimes not a whole lot that we can add to that other than just indicating this is coming in the future. So if we can't provide details about it, we'll at least help to verify that that is coming, and then keep an eye out for more updated information as well.
You can proceed,
Anything else?
Sean. Thank you.
Okay, of course. Man, some hard, I see this, I knew, man, and Medicare brings out the tough questions right away. All right, thanks guys for your bearing with me. So Medicare Pathway 1 is what we're going to be talking about next. So as we had mentioned earlier, so Medicare, original Medicare is going to be that Part A and Part B. And then, as we mentioned, there's a lot of pieces that are not covered, as well as there are other expenses associated with that Part A and Part B that can make Medicare really expensive, and we're going to talk about that in a little bit. So Pathway 1 is really what pieces can be added to your original Medicare. That's going to be Medicare supplement insurance or Medigap plans, and then Part D prescription plans. So as we kind of keep that in mind, Pathway 1 is what we're going to be focusing on right now. And what we're going to go over to next is talking about when you can enroll in Medicare and in that regional Medicare. So there are some folks that can be auto-enrolled in Medicare. Those are going to be for Medicare Part A and Part B. That's going to occur for folks that when they turn 65 are currently receiving Social Security benefits, because folks can start receiving that early, or railroad retirement benefits. There's also auto-enrollment for Medicare for those that are younger than 65 and have that Social Security disability income and have been receiving that for more than 24 months. So once you hit that 24-month period, you would auto-enroll and transition into Medicare. For everyone else that doesn't really fit into those, for the majority of community members that may not fit in those top two groupings, there's something called the initial enrollment period for Medicare. From my background in pieces with working with Sheba, they always talk about it as like the 7-month hug to try and just help people remember and kind of keep it in their brain on when they can enroll. So for Parts A, Parts B, your Part D prescription and Medicare Advantage, and we'll talk about that a little bit later, they all have an initial enrollment period that is surrounded by your birth month when you turn, the month you turn 65. So you can apply for Medicare or start enrolling in Medicare 3 months prior to turning 65, your 65th birthday itself, and 3 months afterwards. We do always encourage community members to start looking as early as possible, so really start that enrollment piece, because as we will notice, it gets complex and there are multiple programs people will want to have choice counseling and look into before they decide on where they're going to fit within Medicare. And especially if you start enrolling after your birth month, those 3 months afterwards, it does push out your enrollment. So if you are 2 months after your birth month and you enroll 2 months afterwards, your Medicare won't start for another 2 months after that. So sometimes things get a little bit tougher or more difficult for folks the longer they wait. Now again, this is an overview. I can show you the literal map of all of the different enrollment periods and when they occur. We're just talking kind of a brief overview of initial enrollment. What does that look like? And what are those steps, just to help you guys familiarize with it, because it can get overwhelming. There's an entire like full page chart on different enrollments. So this is just a brief overview of basic enrollment from here. And then how do I enroll? Where are you going to go? Where the community going to go to enroll? So if they're not part of that automatic enrollment piece or automatic enrollment groupings, they're going to either call the Social Security office directly. You can either go to or contact your local Social Security office, and that is just a link there. So for anybody that has the downloaded PDF, you should be able to click that, and that will take you to the search tool that the Social Security office has. As well as you can go to Social Security Administration's website and apply for Medicare online. Now I know for many of the community members that we work with that are age 65 or enrolling in Medicare, doing things online is not necessarily the easiest for folks. So usually calling or working with their local Social Security office tends to be the easiest for community members to start that initial enrollment in their Part A and Part B. And that initial original Medicare enrollment is what Social Security Administration is going to support with. There are other ways or other support systems if folks happen to miss this enrollment, and we'll talk about that later and how the APD office, the Aging and People's Disability Office, can also support too. All right, I just want to pause. Are there any other questions at all that have come up?
Yeah, we have one, Sean. I'm pretty sure you're going to cover this later, but I wanted you to be able to field it. What is the difference between Medicare Advantage and other supplements?
Fantastic. That is a really, really great question. So we are going to cover that later. So let's pause on that one. But great question. I will do my best to help you guys really understand the differentiation of oftentimes how those different programs fit together and when to choose one over the other, or at least kind of what are the positives and negatives to either program, because it really is dependent on the individual and their needs. But the great question. But yes, we will cover that one. Thank you so much, Dina. Anything else?
That's it.
Sweet. Okay, perfect. All right, just checking time. We're already at 11:28. This is going to be a long training. Okay, I'm going to keep this going. All right, so Medicare expenses. So I wanted to focus on with this training is how much does Medicare cost? The reason being is because I know there are a lot of community members that don't really understand, or maybe they're in good health when they first enroll, and sometimes folks apply for a Medicare or call Social Security Administration and get Medicare Part A and Part B, and that's it. So they just have those two pieces. They don't get any other supplemental health insurance, no Advantage plan, no prescription plan. And this can be really detrimental to people once they start needing prescriptions or other support systems later on. So I just want folks to be aware that Medicare is not, although there are some pieces that are, the majority of it is not free. And what can you do, and how can we help community members to make things more affordable? All right, so Medicare Part A. So again, that's hospital insurance. So whenever you are hospitalized, is there a monthly premium? So this is tied in with that work history that a lot of people have questions about, are like, why do I need to have a work history? What's the purpose of it? How do I make sense of this? So for most of our community members, Part A is premium free. So there's no monthly cost for your Medicare Part A. That is going to be for, again, those same protected groups, those that are on Social Security disability for 24 months or longer, that are receiving Social Security railroad retirement benefits as well, and then end-stage renal disease, other criteria there. But the vast majority of folks, it has to do with your work history. So there are work credits that you are essentially gaining as you are paying taxes, as you are employed, or you have a spouse or former spouse that is employed as well. So your work credits, you can, depending on your income, gain 4 credits per year, up until 40. Once you've reached 40 work credits, you qualify for free premium Part A. If you are a child, a spouse, or a former spouse of someone that also has 40 work credits, you may also qualify for free premium Part A based on their work history and how much they have paid into federal payroll taxes as well. Okay. I'm not going to go into a whole lot of detail with this, just because it can get a little confusing, and it is something, you know, someone's eligibility based on their work history, work credits is really what the Social Security Administration is going to help people identify whether they qualify or not. So I do always recommend people to reach out to the Social Security Administration to identify whether they do or they don't qualify for free premium Part A, so they can make decisions at that point on what they want to do. Yeah, just want to make sure folks kind of have that understanding. Just because you don't have a work history doesn't mean you are not eligible to purchase or to have Medicare, but the work history is really what helps to make Medicare more affordable for community members as well. Okay, so just to kind of give a little bit of brief overview of what Medicare does cost if you don't have enough work credits. So it can be as much as $471 per month if you're between 0 and 30 work credits. So that's usually if you have, 30 years of employment or less, or someone that does. And then if you're between 30 credits and 39 credits, it can be $259 per month. So for folks, this can be a lot of times the difference between someone enrolling or not, being able to afford Part A, or making various decisions. And I do see a question that's come through that is mentioning the marketplace, and so I'll talk about that briefly. Again, some of these topics, guys, we could literally spend the entire time talking about just Medicare Part A. So for those that are 65 or plus and are not eligible for that free Part A, there's kind of various things that you can do. So you don't necessarily have to enroll in Part A. You could just enroll in Part B, which is your outpatient care, especially if it's, if you're looking at a $471 a month bill, that can be really daunting. We also want to make sure that people double check to see whether they may qualify for full dual eligibility and any programs offered through the state that could help pay for that Part A. But if those aren't good options, or they don't qualify for financial assistance through Medicare, the marketplace where people can purchase private health insurance is still a really good viable option for our immigrant community members that don't qualify for free premium Part A under any circumstances, don't qualify for financial assistance for Part A. So as long as you are not enrolled and you don't qualify for free premium Part A, you can purchase and still qualify for financial assistance on the marketplace as well. I hope that helps to answer a little bit of clarity there too. And Tina, is there anything else that came up that I didn't answer?
Nope, just Jasmine said thank you.
Sweet, awesome, perfect, yeah. And again, that's a great reason to reach out to SHEPA if a community member is unsure. They are very knowledgeable about community members that are trying to decide between Marketplace and Medicare. And there are other support systems. It can be a difficult decision, it can. And we want to make sure that people are making the best educated decision they can. Most importantly, we want to make sure they're just not going without health insurance, and that we help them find an option, okay? All right, guys, so other costs associated with Medicare Part A is going to be, what does it cost when you are hospitalized? So just because you're potentially paying your premium, or even if your premium is free, there's still going to be other costs associated with it. So I'll try and break this down a little bit. I don't want to go into the weeds, but just helpful for you guys to know. So when you're hospitalized, you will go into what's called a benefit period. A benefit period begins the first day of your hospitalization and ends when you are released. And then if there's 60 consecutive days after you're released before you're hospitalized again, you will enter a new benefit period. So the reason why I'm talking about that is that whenever you're hospitalized, each benefit period, you can have a $1,484 deductible, as well as if you're in the hospital longer than 60 days, you can start accruing costs of up to $371 per day for each benefit period that you're hospitalized as well. So it can be very expensive for folks, even when they are in the hospital, even when they have Part A. So this is why we're talking about, okay, what are these expenses, and then what are things can people do? What are the health insurance can they add on to help take away some of these extra costs? Skilled nursing, similar thing. You're going to have a benefit period of the $1,484 deductible. And then if you're in a skilled nursing facility for more than 21 days, you start accruing more and more costs. So that's going to be, $185 per day for anyone over 21 days in skilled nursing facilities as well. Okay.
We have a question.
Yeah, go for it.
Is it fine to work until she or he meets 40 credits, even though she or he is over 65? Then enrolls in Medicare?
That's a really good question. That is a fairly complex question. It really depends too on, and again, with this overview that we're doing, if you are continuing to work and you receive health insurance through your employer, oftentimes you can postpone your enrollment in Medicare Part A and Part B. There are sometimes, if you don't have other health insurance and you're still working, There can sometimes be penalties associated with delaying your enrollment. So let me get a little bit more background on that one. And Donna will be a really good one to help us get a good detailed overview. That's a really great question though. I want to get some more background there. Yeah, so many really good questions. All right, so anything else, Tina?
No, that's all.
Okay, awesome. All right, and then with Medicare Part B, your medical insurance, your outpatient care, your urgent care visits, things like that, there are also a monthly cost associated with your Part B. So for the majority of the community members that, as community partners that you will be working with, that usually comes out to about $148.50 per month for monthly premium. They have an annual deductible, it's $203. Those can go up a little bit every year, so it's really important for people to check in, double check, because especially with your Part B is oftentimes being deducted out of someone's Social Security automatically, and sometimes they can kind of forget how much they're paying since it's done every single time for them. But it can change a little bit. The monthly premiums for Part B do go up if your income or your annual income is higher. So, and it's going to be based on your gross income as well. I'm not going to go over into detail. We're talking about individuals, an individual person or joint income of, so if you're an individual making more than $80,000 a year, joint $176,000 a year. If you're above that limit, then your Part B can increase. It can go upwards to, I think, as much as $500 a month, but you have to be making, you know, $500,000 a year to incur that kind of cost. So majority of the folks we work with, there could probably be around that $148 a month. Okay. Apart from that monthly premium, once you've met your deductible, you're also still responsible for 20% of any Medicare approved amount or any Medicare approved service that you receive. So that's a co-insurance. So for folks that are unfamiliar with some of the terminology, co-insurance is a percentage that you are responsible for paying, not a set amount, but a percentage. So if you're getting a CAT scan and that CAT scan is $3,000, you would be paying 20% of that as well. So again, the whole point of this and the purpose of this is for me to show there are a lot of expenses, and that is why it is extremely important that people enroll in some of the other supportive systems, the other supplement plans, Medicare Advantage plans, depending on what's best for them. Okay. All right, so now we're going to talk about one of those particular programs, and that's going to be your Medicare Supplement or Medigap. So I know folks were asking kind of what's the difference between a Medigap plan versus a Medicare Advantage plan. So when we're going down that pathway one of keeping your original Medicare, there are only certain ways that you can package Medicare together. So if you want to keep original Medicare, have your Part A, Part B, be able to see anybody that accepts original Medicare, which is kind of one of those nice things about original Medicare is you can go anywhere within the US, and if someone accepts original Medicare, like fee for service, you can be seen with them. There's no restrictive plans like there can be with Medicare Advantage plans. So in order to help with those original Medicare expenses, people can enroll in a Medigap plan or a Medicare Supplement plan. They essentially are filling in those gaps. So helping to cover your deductible, any co-insurances that are associated with a Medicare Part A or Part B, they would cover that hospitalization deductible for every out-of-pocket expense. They do have premiums. I can show you, there is a booklet that is in this training as well, guys, that will show you the many different options of different types of Medigap plans. But the majority of them, the purpose is to really help with those expenses that are not covered by your original Medicare. So that 20% out of pocket, they vary depending on what you want covered. The majority of them, including original Medicare, don't have an out-of-pocket maximum, which is another reason why you really want to help people, encourage people to enroll in some of these supplement plans. There are some Medicare supplement plans called innovative plans that can add on extra benefits like routine dental, vision, hearing, and annual physical exam. Again, those are limited, so it's going to be routine dental, it's going to be your preventive care, it's not going to be dentures. And your premiums can go up and down depending on what plan you go through. I don't want to go into too much detail because they also have letters associated with them. I think they go from A to N. So there are many different types of plans. That's why it really is important if people are looking between Medigap or going towards like a Medicare Advantage plan, a licensed insurance agent, working with a SHIBA, Senior Health Insurance Benefits Assistance Program, a SHIBA counselor. They can purchase plans directly from the carriers themselves over the phone, but they definitely are going to want to look into some choice counseling and getting some support on what kind of plan. But the point of these is really to help cover those out-of-pocket expense plans, sorry. When to enroll, you can, a community member can purchase this before their Medicare begins. So part of that initial 3 months before your 65th birthday, when your Medicare will actually start, as well as they can continue to purchase a Medigap plan 6 months afterwards in the kind of general enrollment period, initial enrollment period for Medigap. You can purchase a Medigap plan at any time, but we definitely want to encourage folks to purchase a plan earlier on during this initial enrollment period for Medigap, because you are protected essentially from what's called underwriting or medical underwriting. So if you're not in this initial enrollment period, health plans can, and Medigap plans specifically, can deny you benefits. They can increase your costs based on your health as well if you're out of this enrollment period. So there are fewer protections, even though you can enroll at any time. So it's really good for people to know right up front what may they be eligible for. Okay. Any questions about Medigap policies or Medigap plans? Let's come up.
No questions, Sean. Just it's 45 after.
I know. Thank you. Yeah. Okay, guys. All right. So let's move things along here. Again, I can even myself become very winded with my descriptions. All right. So Medicare Part D. So this is what can be also added on to your original Medicare. So you can have Part A, Part B, a Medigap policy, and then a Part D prescription plan. So this is what's going to cover your out of hospital prescription costs. They do have monthly premiums as well. They can range from, I think the average is between $32 to $44 per month. They also have annual deductibles of $445, as well as our co-pays and co-insurances too associated with these Part D prescription plans. But this is also something too, there are tens and 20s of different types of Part D prescription plans. I encourage people to get support, get choice counseling, because just because a plan is the most expensive or just because it's the most affordable doesn't necessarily mean it's going to meet their particular prescription costs and their particular needs. After someone meets their deductible, the plans usually cover at least 75% of your drug costs. So there are still going to be expenses associated with Part D prescriptions plans and getting just prescriptions in general. And you can purchase those plans at Medicare.gov. And then we'll look at, there is a financial assistance program as well that can help assist with prescription costs that are not covered by your Part D. That are really, really, really important to help get people enrolled in as well. We don't talk about it just very often, so I'm excited to cover that today as well.
I have a question, Sean, about when and how do we enroll for Part D?
That's perfect. So once you've enrolled in your original Medicare, you'll go to Medicare.gov. Someone can create their own account, and then it'll allow them to add all of their, I used to assist people with Part D prescription enrollments. It will allow you to add all of your prescriptions into your system, into Medicare.gov, into their account, and then they can pick and choose and see what their costs are going to be and what's the most affordable plan for them. Even just looking at Part D prescription plans, it can take upwards to an hour or so to go through everything depending on people's prescription needs. Again, you can also always go to a licensed agent. A Sheba counselor as well can help people with these enrollments too. That's what I did when I was working for their department. So hopefully that helps. I know these things are all over different. So Part A and Part B, you go to Social Security Administration. Part D, you go to Medicare.gov. For Medigap plans, you go to a licensed agent. This is what can make Medicare a little bit overwhelming. Okay. So guys, now I'm going to talk about the Medicare Pathway 2. That's going to talk about how can people combine their Medicare in a different fashion. So we talked about Medigap policies that go with your original Medicare, Medicare Advantage plans or Part C plans, which I find makes it very confusing when you call it a Part C. It essentially is going to package all of your Medicare all under one roof. You can sometimes select plans without prescription, but most folks that I've seen, when they select a Medicare Advantage plan, they select it with their prescription. So it's going to combine all of your Part A, your Part B, hospital outpatient, and your prescription costs all under one roof, instead of having all these different plans. The only thing is that once you choose a Medicare Advantage pathway, you cannot enroll in a Medigap policy. You don't technically, although you do retain your Medicare Part A and Part B, all of your care will go through that Medicare Advantage plan, and you will have more of a restrictive grouping of providers that you can see, but it does add some other advantages as well. So we'll go over those pretty quickly. So private insurance contracts for Medicare, they offer coordinated care a lot like our CCOs do, and they provide combination packages for Part A, Part B, and Part D all together under one roof. You do keep your Part A and your Part B, but essentially what ends up happening is the Social Security Administration starts taking your premiums that you pay for Part A, for Part B, Part A if you do, and they give that to the Medicare Advantage plan to help cover those costs for you and to manage your care for you as well. So let's see here. What will change? Sometimes folks will have a premium for their plan. I think this does get a little bit confusing because sometimes they will see $0 premium plans. I know a lot of our the folks get a lot of bombardments of commercials that say that there's $0 premiums. You will always continue to pay your Part B premium. That will be taken automatically, oftentimes out by Social Security Administration. If the plan has any extra premium, then that will be added on top of that $148 that folks are paying. So depending on what people's needs are, many folks go with a $0 premium plan. You can add more. You're going to have co-pays, co-insurance, deductibles like you do for any other health insurance plan. The one helpful thing too that I also find with Medicare Advantage plans is that you do have an out-of-pocket maximum. So that provides extra protection, I feel like, for community members so that they have an extended amount that they will pay. A lot of these Medicare Advantage plans also do add dental, hearing, vision in order to stay competitive. They offer these extra plans and extra options as well to kind of attract people from original Medicare over to Medicare Advantage, if that makes sense. All right. And any questions as well that folks have?
I have a question, yes. Are we going to touch on our abilities to help people get Medicare savings programs, Line T Part D, etc.?
A little bit, as I mentioned, and I see that they came from Sean. Thanks, Sean, for that question. If there's anything that we don't cover today that folks have other questions about, I know things are going a little bit longer than I wanted just in covering the Medicare 101 pieces. We're talking about a little bit about the Medicare savings programs, and that's stuff that Heather and Janelle will be able to touch on as well. So if there's anything we don't answer, feel free to send those questions to us, and I'll make sure that they get answered as well. Again, things got changed a little bit as we were going through the development of this training. So, all right, I'm going to move forward, guys, just to keep us going. Okay, so for Medicare Advantage plans, there are going to be various types of plans that people can sign up for. There are health maintenance organizations, HMO plans. Those are going to be the ones that generally your care and services are received are within a provider's plan and network. Exceptions, of course, are emergency care and out of area urgent care as well. You have preferred provider organization plans where people, you do have a network similar to an HMO, but you do have an option to choose to go to other providers that are outside of the plan's network. They do oftentimes add extra expenses to see those physicians. And then there are other really cool plans called special needs plans that limit their membership to people that have specific diseases or other characteristics that qualify for the plan. And they are tailor their benefits and provider choices and drug formulas to those specific needs as well. So if folks have more questions about special needs plans, we can always get more information about that as well. Medicare Advantage plans, you can also apply and purchase those at Medicare.gov on that My Medicare account that we talked about earlier with Part D plans, and kind of choose between and see what works best for you. Again, that's something that licensed agents and the Sheba team as well can provide support. When to enroll, you can enroll during your Medicare initial enrollment period. So as we talked about that 3-month hug earlier, once you're enrolled in your Part A and Part B, or at least have initiated that, you can start looking at Medicare Advantage plans. There is an annual enrollment every year from October 15th to December 7th, so people can change their Medicare Advantage plans year to year, a little bit more flexibility than some of our other program options. And there are other special enrollment periods that we're not going to get into today. There's an entire packet just on special enrollment periods as well. Okay. All right, sorry that got a little quick there. I was not keeping track of my time as well as I should have. So we're now going to dive into the non-MAGI programs, the OSIPM and Medicare savings programs. So Oregon Supplement Income Program Medical is what OSIPM stands for. That's our full OHP benefits for those that are with a need, and Medicare savings programs as well are to help those that are on Medicare and help pay for out-of-pocket Medicare costs as well. And I'm definitely going to lean on Janelle or Heather if there's anything else that you'd like to add on to any of these programs, please let me know. So when you guys are helping people enroll or see whether they may qualify for OSIPM programs or Medicare savings programs, that's where you guys really can come in and help people with that enrollment through the one system. So we'll go over briefly of like what these things help to cover, what their purposes are. So OSIPM is a non-MAGI program that essentially is full OHP benefits. So they will oftentimes have a CCO or coordinated care organization, as well as Medicare benefits too. The OSIPM programs eligibility qualifiers are for those that are age 65 and older, blind or disabled. There are some income limits. Those income limits are the same for adults and children, and there are some resource limits as well. So for individual program and for those that are individuals or married, those are the income limits there, as well as the asset limits. There are other programs within OSIPM, such as the Employed Persons with Disability program as well. I didn't add their limits in here because it's a fairly complex program in some of their criteria, and I didn't want to make things confusing for folks. But I wanted to check with Janelle or Heather, is there anything that you wanted to add, some more details about the OSIPM program at all?
Hi, this is Heather. Yeah, I just wanted to mention that the income and resource limits, or the income limits rather, that are listed here, that is like basic non-service. So someone who's not requesting or receiving long-term care services, someone who's doesn't have protected eligibility. There's all kinds of different ways to qualify for OSIPM. So I just want to note that this is not hard and fast. So I mean, these limits exist, but there are all kinds of different ways for individuals in addition to EPD, the Employed Persons with Disabilities program, to qualify for OSIPM. So when you're looking at this, I mean, the resource limits are pretty set, but that doesn't take into account spousal impoverishment for long term. I mean, and there's all kinds of subtleties there. So just keep in mind, don't look at this and say, oh my gosh, no one's gonna, you know what I mean? But
Exactly.
I think you probably, yeah.
Perfect. Thank you. Yeah, and that's true. And like I mentioned with a lot of these things that we're talking about today, this is like the highest overview. And never should we ever deter anybody from applying. And just because I have an income limit on here doesn't mean that there aren't exceptions, and there aren't other criteria as well, or other qualifiers that we're looking at too.
So this is Janelle. I'll just add for EPD, like you said, it is very complex. There are various deductions and things, just like all of our other programs. But a good way to think about just super basic is an employed person who has some kind of disability can potentially make $5,234 gross per month and be eligible for that program, because we only look at that employment income. So it's a good starting point right there. So just know that one is intended for people to be able to work. So we give all kinds of different deductions and leeway and everything like that. That's why they can make so much more than most of our other programs.
Which is absolutely fantastic. I mean, I still have so much to learn about the Employed Persons with Disability Program, but it really does sound like that. I'm just glad that it exists and allows people to really still have that agency and that ability to work. And still qualify for full OHP as well. One thing too I wanted to mention that I'd kind of skipped over a little bit is for folks that don't qualify for maybe full Medicare, or folks that are non-citizens as well. There is a emergency level of OSIPM similar to our CalWAM emergency coverage that folks apply for that are younger than 65 as well. So there are other benefits too that will hopefully cover more in detail at another point as well. All right, thank you so much, Janelle and Heather. I appreciate it.
So Sean, did you answer the questions then, or address all questions that were in the chat, all three?
I think at this point, and I apologize, this is my fault for rushing us a little bit. I think we're just gonna, for interest of time and making sure that things get answered clearly, especially for the Medicare savings programs. I didn't mean for them to get crushed so much at the end, but for me to work with Heather, Janelle, and Donna to get better, clear answers for those as well. And I apologize, guys, for it being a little bit rushed here. Does that work?
Yeah, I'll document them all for us to follow up.
Awesome.
So we're gonna
Thanks
just
so
go
much.
a few minutes over to make sure we're getting everything in.
Yeah, I think it's going to end up happening. So if folks need to jump off, that's okay. And again, this will be recorded, and if folks are able to continue a little bit into their lunch break, I'm willing to stay as well. I apologize. I am very long-winded sometimes when talking about these programs. Okay, so the other piece, apart from the OSIPM programs, is Medicare savings programs benefits. And those are not necessarily going to be full OHP coverage with your Medicare, but essentially it's going to help to cover the out-of-pocket costs for Medicare that either aren't covered through original Medicare, helps to lower costs for folks that have the other combined services with their Medicare Advantage plans, their Medigap policies, and really helps to make Medicare affordable and bring costs down as low as possible and very close to OHP level care with OHP level incomes as well. So there are different levels depending on someone's income and other criteria. Thankfully, with Medicare savings programs, there are not resource limits any longer. But the three that we're going to talk about briefly is the Qualified Medicare Beneficiary Basic, or QMB-BAS. That covers Part A or Part B premiums, Part A and Part B premiums if they say don't qualify for free Part A. Also covers deductibles, co-insurances, and co-pays. So almost all of your out-of-Medicare Medicare costs are covered by the QMB, that highest level, which is one that's just, again, if we can help community members identify and find out that they may qualify for some of these programs, it's the difference between Medicare being affordable and not in many ways, especially for immigrant community members too. Then we have the Special Limited Medicare Beneficiary QMB SMB. That covers Medicare Part B premium only, and then qualified individuals QMB SMF And Heather, is there anything that you do?
Just that the qualified individual program cannot coexist with any other Medicaid program. So if they're eligible for OHP plus, they cannot have qualified individual or SMF, but
Perfect.
we will pay that Part B premium regardless. So it's not really a big deal. I mean,
Okay,
all in
perfect. So essentially, they don't overlap with each other.
Correct.
That makes sense. All right, anything else, guys? And again, I do apologize for things being rushed at the end, but let's see here. So we'll go ahead and move forward. And again, as Janelle and Heather mentioned earlier too, this is the briefest overview of eligibility. This is not to be used at all as a deterrent for someone applying or saying whether someone does or doesn't. I know that I used income limits sometimes as a way to encourage people or help them kind of understand a little bit, but not as a way for them not to say, oh, you do or you don't. There are so many different programs. It is so complex. Always just encourage people to apply regardless, okay? But these are just the income limits for the programs. These change and adjust every year. Again, there are no resource limits for Medicare savings programs. So they can be fairly low, but even if people are helping to qualify for some of these, Part B or their Part A to be covered, it really is the difference between being able to afford their care and not. And there are other qualifiers too, besides income. I wasn't sure if we wanted to talk about any of that at all, Heather, about some of the other qualifiers for Medicare savings programs, the long-term care services or other protected groups.
Part A eligibility is probably the basic one. You have to have, for QMB, you just have to be eligible to enroll. If you're income eligible, of course, we can help pay that Part A premium. So you don't have to be enrolled in Part A when you walk in the door. But for the other two, you have to be enrolled in Part A to qualify. Okay. And then, shoot, there was one other thing I wanted to mention. The immigration, the non-citizen rules apply across the board to Medicare savings program, just like they do for other Medicaid programs. I did want to correct myself on the 5-year bar someone had mentioned. What I was talking about was the House Bill 2164, and that's a state program that was looking into not eliminating the 5-year bar, but just offering coverage to certain individuals. It's a state program. It's not a Medicaid. There's nothing that I have heard of federally about getting rid of the 5-year bar. So I did want to clarify that in case I'm spreading rumors. So
no worries.
Yeah,
and that's kind of helping to differentiate between the federal program versus our state programs, where we're kind of able to, with the cover all people, remove the immigration limits for our state Medicaid programs. Would that be, but that's not going to be applied to Medicare as well, correct? Or to the Medicare savings programs?
Correct. Oh, okay. I don't know. I don't want to speak because that's the rumor I was hearing about. I know very little about it.
No worries. Again, there's going to be more to come about that. I really hope that it can, but again, just keep an eye out for more information about that program, and if it can integrate with Medicare, we'll have more information on that as well too, guys. Okay, and then the last program I wanted to talk about really quickly is the prescription drug help for low-income individuals. LIS is sometimes the way that you'll see it, or Extra Help is oftentimes the name of the program. And this is separate from Medicare savings programs. It's separate from OSIPM, and it is a program that folks can apply for through the Social Security Administration as well. And I apologize, Janelle and Heather, do folks at the APD office, do they assist with Extra Help enrollment as well?
What happens, there's a couple things here. One, anyone who's eligible for any sort of Medicaid benefit is automatically deemed eligible for LIS. So in that way, yes. For the most part, And the other side of that is individuals who apply for LI. I mean, this is kind of not the question, but any individuals who apply for LIS with Social Security are referred to the Medicaid agency. So it's kind of the opposite. But we don't train how to specifically help individuals with LIS only. It's mostly getting them on Medicaid, you know, and the LIS would follow, if that makes sense. As far as aging on people with disabilities and like branch offices, but I know, you know, there are other offices that will help with that.
Awesome, that's perfect. No worries. And I know I put you on the spot a little bit with that one as well. And that's really wonderful to hear too. And I do remember and recall hearing that how the Social Security Administration and you guys will all as well share information back and forth, really helping to make sure that people are getting enrolled in all of the financial assistance programs that they may qualify for. So it's really good to hear that as well. I think it's just good for folks to know, because when you guys are helping people apply for some of these savings programs, the one that isn't necessary, so say if people are, and please do correct me as well, Janelle and Heather with this one, if folks are over the income limit for you know, the Medicare savings programs, OSIPM program as well, they could still qualify for at least financial assistance for their prescription drugs, which can help people lower their prescriptions to almost nothing, and can sometimes people are saying it's worth close to like $4,000 a year's worth of prescription assistance, depending on what that person's needs are. And this is not one that we talk about very frequently, but hopefully we'll have more information to share with folks as well. And I'll make sure that folks have the abilities to sign up for this program as well. But it's good to know that even when people are getting referred over to our EPD programs, that they're getting that support and help through the buy-in units as well with that piece too. All right, guys, let's see here. So for how to apply for savings programs, as you guys know, that's going to be through the for the Medicare savings programs for OSIPM. It's going to be the one applicant portal. They can apply online with you all, with community partners, by phone, by calling the 1-800 number. They can apply for these programs at local store offices, at ODHS, and at APD. And then for the extra help program, if they are not already automatically enrolled because of their eligibility for other Medicare savings programs, OSIPM or other programs as well, they can apply online at the Social Security Administration office. And that is a link there too for folks to be able to apply for that program as well. All right, and then I think for interest of time, I'm gonna, and let me know, Dina, as well, if we should skip the, there was a few slides that I had with that Q&A, but I think with it being 12:12 already, what I'm gonna do is I'm just gonna send a follow-up for everyone that attended today with those Q&A and questions answered, with everyone's other questions that they brought up today with those answers as well. I appreciate everybody bearing with me and sticking with me to today, and I apologize if things went over pieces that folks weren't quite expecting, but I will try and answer people's questions as best I can in the next coming days here as well. But just want to see, Dina, were there any questions that we might be able to cover that you felt like would be helpful to folks or might tie in easily to what we went over today?
I documented them. One of the main ones I think would have been good, the person has left. I'm thinking we just respond to these by email.
Perfect.
One of them was a helpful comment that actually talks about the APD buy-in unit, I think, which you have a slide on, but it's not in there right now, so for the interest of time.
No worries, that's totally fine. And I appreciate you looking at that on the back end. Again, guys, I'll follow up with all of the answers to the questions that we brought up today. I apologize for things being rushed towards the end, and thank you for everyone that was able to join today. Janelle and Heather, thank you for being here to help supply a little bit of background and a little bit more information into the Medicare savings programs and OSIPM programs as well. And I just want to thank folks for being here and taking the time. and I'll make sure to follow up with more answers. And I'm hoping that we will continue to have more questions for understanding Medicare. As you can see, even for myself, I'm always continuing to learn more. There are a lot to bring up in regards to Medicare. So thank you all for joining today.